Hello and welcome back to the first Brain Fit for Life symposium. My name is Irene Meier. I'm a clinical neuroscientist and have experience in digital biomarkers and digital healthcare. And this is the topic of our second session as well. This is focusing on digital diagnostics as a proof of concept for clinician and patient use. And it is now my pleasure to introduce our first speaker, Sam Ewing, talking on the Plateau of Productivity, Where are wearables? Sam is an astrophysicist, neuroscientist, and biomedical engineer with a passion for making the unobservable observable and to improve our understanding of life, the universe, and everything. Enjoy.
Good afternoon, everybody. I'm Samuel Ewing, and I'm currently the Senior Product Manager at Biofourmis AG, where I currently lead the development of our platform for remote monitoring of physiology and behavior using our medical grade wearables. I was formerly the sensor lead for Roche's digital biomarker group, where I was responsible for technology evaluation selection and digital endpoint development for their digital biomarker augmented clinical trials across Roche's neuroscience portfolio. And going back slightly further still, I was the chief neuroscientist at NeuroPro and a consultant to wearable sensing, both of whom were, and still are, engaged in the development of wearable brain monitoring devices. I believe Dr. Meier was convinced that based on these experiences, I may be able to cast some light on where we're up to with wearables. So I'd like to thank the organizers, and particularly Dr. Meier, for inviting me to take part in this great session and on putting together this excellent program. I chose the talk title, The Plateau of Productivity, Where are the wearables? Partly because I love puns, but also because the Gartner hype cycle for emerging technologies predicted back in 2015 that wearables would reach the plateau of productivity between 2020 and 2025. So we should be there about now. So Dr. Meier has given me a perfect opportunity to review this prediction, particularly in the context of brain health, which remains my greatest research interest. During this talk, I will review the current state of the art for wearables as they loosely pertain to the major milestones on a patient's journey from full health to clinically diagnosed dementia. I'll approach the journey in reverse order from worst health to best health, since although most advanced and technically interesting technologies occur at the latter stages of the patient journey, the technologies with the greatest potential for large-scale societal impact occur earliest in the patient journey. And while these technologies are ostensibly simpler, their operationalization to achieve that potential impact is the most complex, and I think raises the most interesting questions in digital health as we move forward. I'd initially considered skipping over brain imaging wearables, since strictly speaking with my Biofourmis hat on, I should focus predominantly on photoplethysmographic wearables for heart rate, etc. However, there is a potential for significant impact on the delivery of healthcare in the context of dementia at all stages along the patient journey. And I wanted to leave the audience considering all of those possibilities of how we might advance healthcare as a whole, reduce costs and improve outcomes through all of the technologies that are currently available, since there is certainly no one wearable to rule them all. So I'll start with a whirlwind tour of contemporary brain monitoring devices, probably most suitable for in-clinic use, before striding out into what we normally call the real world and getting our hands dirty with smartphone technologies and wearables. So in reverse order, the latter stages of the patient journey are sadly a diagnosis of dementia. Are there technologies available that can improve the patient experience even at these later stages? Well, the answer is probably closer to maybe than an outright yes, since to the best of my understanding, EEG is not routinely performed for dementia diagnosis. However, it may be of value in discriminating the type of dementia, since, for example, Alzheimer's disease and dementia with Lewy bodies have markedly different EEG signatures. Analyzing these signatures requires a full 1020 montage, making it unlikely that consumer-grade EEG wearables such as Muse and Dream could be of any valuable in remote monitoring of EEG in dementia given their low channel counts. I'd argue that truly remote, and by which I mean at home, monitoring of EEG is sufficiently limited in value in dementia that it would not be worthwhile addressing the significantly complex challenges of operationalizing that. However, that's not to say that there is no value in using contemporary EEG technologies to shift such EEG exams from specialized centers and out into, say, a local doctor's office. Traditional EEG is bulky and cumbersome. It requires significant technical expertise and is delivered in specialist centers by highly trained professionals. And like many technologies in medicine, it's not changed much for about 150 years. It's slow, messy, and expensive, and makes significant demands of a patient's resources in traveling to and from a site and dealing with new and strange people in strange and stressful environments, not to mention all the gunk that it leaves in your hair. Contemporary technologies require limited technical expertise, no messy conductive gels, and could easily be conducted in a local doctor's office by a patient's personal doctor, thus reducing stress on the patient and their caregivers while reducing the cost of delivery for the EEG exam to the health service. Wearable 1020 systems have existed for many years that rival and arguably outperform their traditional counterparts, yet the adoption of them is still lagging way behind and is very slow. Systems such as Wearable Sensing's DSI-24, Cognionics Quick20, and Zito have all been developed to provide rapid acquisition of EEG using cutting-edge dry sensor interfaces that could all potentially improve monitoring of brain health at scale that is frankly impossible with traditional wet EEG systems. However, while scaling data and reducing costs is great news for research and healthcare systems, the benefit beyond reducing patient burden is somewhat limited. So I question, can we do better using technologies to engage earlier in the patient journey to improve interventions and outcomes? Taking a step slightly further back, functional near-infrared spectroscopy is another brain imaging tool that is making the transition from bulky, complicated lab equipment to wearable technology. Similar to the more mature EEG space, this technology has the potential to become more scalable, reduce testing time, and thus reduce patient burden, while increasing diagnostic accuracy. For example, some authors have reported accuracies of close to 99% for diagnosing mild cognitive impairment using FNIRS during an NBAC test. Thus, I believe that FNIRS represents an opportunity for scaling its use in diagnostic settings and achieving accurate diagnosis of MCI, and thus a tangible first point on a patient's journey for earlier intervention. So far we've touched on technologies that may improve diagnostic accuracy in dementia, but they both require that a patient has been identified and referred to a specialist in the first place, i.e. at a point when we know there's a problem, but perhaps we don't exactly know what the problem is. While these in themselves are great benefits for optimizing treatment strategies, one wonders if we can do even better and identify patients even earlier on their journey. It's evident that the sooner that we can make an intervention on a patient's journey towards dementia, the more likely that the intervention is to be impactful. So how could it be possible to make interventions before there being any overt signs of developing a condition that requires an intervention? For me, this is the greatest question in digital health that we'll need to address moving forward. To put it bluntly, the validity of collecting data with mobile devices in real-world settings, which we often obsess over, is moot if no data was collected due to either lack of awareness that data should be collected and or lack of engagement that once that need is identified. Solving this problem is not likely to be possible by asking people to actively engage in surveys or electronic clinical outcome assessments on a regular basis. People who perceive themselves as well simply are not interested in engaging with boring content. Yet billions of people pour boring content into their smartphones every day through interfaces that can capture precision typing data that could be used to identify motor and cognitive disorders much sooner than they would typically be referred to a professional. Companies such as Mindstrong and Neurocast are already making headway in this space, and it is my belief that the humble smartphone keyboard will provide one of the sharpest tools in monitoring brain health and detecting mild cognitive impairment in the future. So stepping back slightly further and possibly off the patient journey, and I say off because we're heading into the stage where the patient is merely a possibility and thus not a patient yet. They only have some likelihood of becoming a patient at some point in the seemingly far distant future. And there appears to be substantial evidence that dementia may be linked to cardiovascular health much earlier in life. And thus it becomes interesting to consider if we can A, monitor that cardiovascular health in the very long term and study progression towards dementia, and B, understand that cardiovascular health with sufficient confidence that predictions made about future progression to dementia carry sufficient weight to justify interventions made many years in advance. At a purely technical level, this kind of continuous monitoring of cardiovascular health is now reasonably mature. The wearable landscape is well over the peak of inflated expectations that brought hundreds, possibly thousands, of gadgets and fitness wearables onto the market. Many of the big players are now consolidating to create a smaller but more reliable pool of wearables. Much of the junk has dispersed, and we as consumers now have the luxury of choice between many smartwatches with FDA-cleared algorithms. For example, the Apple Watch and Fitbit/Google, hopefully. And to keep the space interesting, Garmin's collaboration with Actigraph and its acquisition of Firstbeat place it very competitively in the remote patient monitoring category. And while competition is economically healthy, It is something of a relief to see this consolidation in the saturated space, since there was a time, and it really wasn't very long ago, when one had to sift through a seemingly endless landscape of nearly identical wearables to select devices for remote patient monitoring. I truly hope the narrowing of the solution space makes it a lot easier to create digital health platforms that can survive for the very many years that they're going to be needed to generate real value. A number of studies, though, indicate that heart failure is associated with both cognitive impairment and dementia. Biofourmis, our flagship product, is specifically designed for monitoring heart failure, and it will be very interesting, wherever possible, to follow the trajectory of those patients enrolled in our systems to better understand progression to dementia. While the battle for the wrist, indicated on the previous slide, is just getting underway, with Apple currently out in front by several country miles, there is an increasing number of wearables following our suit and turning their attention to the upper arm. For example, Current Health and Kenzen. Biofourmis, and formerly Biovotion, have been leading the development of upper arm medically approved wearables for nearly a decade for a couple of very simple reasons. The data it is possible to collect from the upper arm is more robust than that collected at the wrist, and the anatomical location allows for a larger design, allowing much greater comfort and larger battery sizes, and thus makes it possible to monitor for much longer durations between charges. This increasing traction for the upper arm is driven predominantly by manufacturers like us who are seeking to improve the whole device as a medical device rather than only some algorithmic component of an otherwise consumer device. And thus, we're increasing the availability of truly wearable, medically approved health monitors, which is great news for healthcare researchers interested in cracking the code of engaging with healthcare consumers before they are ill. And with that unashamed plug, and I mean unashamed, right? I take our development of medical grade wearables very, very seriously and passionately believe that we're delivering best-in-class devices for capturing best-in-class data for enabling validated monitoring of health in the real world. But for me, the question is no longer, can it be measured? Wearables have evolved into mature, reliable technologies across a broad range of physiological inputs that are more than capable of delivering on the hype, providing that users engage with the technology in the first place. The question is how to engage people and drive participation in digital health ecosystems. This, in my opinion, is the biggest barrier to delivering on the promises of mobile health and wearables. The dialogue that wearables are unreliable is just an artifact of resistance from a community that is notoriously resistant to change. As I see it, the challenge is no longer in trusting the data, but in one, engaging with healthcare consumers to generate and keep on generating the data that describes their current health status. 2, curating that data that describes their historic health status. And then 3, validating predictions about a participant's future health status. 2 and 3 are largely technical challenges that are mostly solved. They're sufficiently straightforward that I'll choose to close in consideration of the final problem. How do we engage with healthcare consumers to monitor themselves over a period for which they may see no need to initiate monitoring in the first place? Ask yourselves as an audience, would I monitor my health when I believe myself to be in fine health? And let's say we can initially convince healthy people to massively adopt wearable monitoring. How do we then keep them engaged when the period over which they may see return on their effort could be decades in scale? So in summary, I believe that there is great opportunity to leverage contemporary wearable technologies to improve the patient experience all along the dementia journey. 1, wearable EEG can enable scaling of differential diagnosis of dementia by transferring data acquisition from specialist centers to something that can happen routinely in a local doctor's office, and thus reducing patient burden. 2, wearable functional near-infrared spectroscopy could be used to improve the diagnosis of MCI, also in a GP's office, rather than requiring referral to specialist centers, and thus enabling improved earlier intervention. And I believe that correctly managed, particularly from a data security and privacy point of view, that appropriate monitoring of input on smartphone keyboards will provide a passive window into cognition that is much needed to make predictions about progression to MCI from otherwise healthy individuals who more than likely do not see value in monitoring their mental health. And while the technology is mature and reliable, I believe that we're still some way from convincing healthcare consumers to monitor their cardiovascular health, specifically as a precursor to their mental health. We're likely to need engagement programs spanning many, many years, possibly mediated by governments, to create this kind of cultural shift in the way we use healthcare technology. So at this stage, I'm convinced that wearables have entered the plateau of productivity. However, that productivity for me is likely to remain driven by relatively short-term use cases in the immediate term due to the unsolved challenges engaging otherwise healthy individuals in the monitoring of their health status for the timescales needed to make major dents in the progression to dementia. However, before I close, I'd like to make one final observation pertaining to this pretty wacky year that has been 2020. COVID, from my reading, has changed many, many things for the better or worse. A persistent dialogue has arisen and snowballed in popular media over the last 6 months regarding our general awareness and interest in our mental health due to the rapid changes in the way that we work, in the way that we socialize, and fundamentally in how we live. Perhaps COVID has given us the opportunity to engage people engaging with their mental health earlier than they would have done otherwise. And perhaps now is exactly the right time to accelerate the adoption of wearable health monitors, not as cheap fitness gadgets that are here one week and gone the next, but as long-term monitoring devices to help us transition into healthy old age. Since, after all, as Ashley Montague put it, the aim is to die young as late as possible. And with that, I will take any questions.
Thank you very much, Sam. Great talk. And maybe let me start with the first question, connecting back to a talk that we had this morning that mentioned how urgent we need, or how urgently we need a paradigm change in Alzheimer's disease specifically. Do you think maybe wearables could be the or one of the answers to that? And if so, what would need to happen in that space?
I think for the Alzheimer's space, it's a bit of a long play. The wearables space is predominantly focused on things that are kind of obvious, if you'll allow me to say that right now. So we've got heart rate monitors that are there for monitoring heart rate where the issue is some issue with your heart, right? And then to make that leap from cardiovascular factors into mental health is going to require generating years and years of data. So I 100% agree that now is the right time to begin initiating that kind of research. But are we going to see a return on it in 6, 12 months? No, I don't think so, right? We're going to need to generate decades scale of data to really show that what we're monitoring in people who are 30, 40, 50-year-olds now can make those predictions about those people transitioning into Alzheimer's. So I think we're talking about needing to make cultural shifts over a very long period, and we've got to keep people engaged also over a very long period.
Great. And then we have one more question. Do you think that a subcutaneous microchip might be a next step in monitoring our health?
As in implanted? Yes. It's not that far-fetched, right? There are certainly people out there who are driving that kind of technology. Again, I'd kind of say that they're a bit sort of crackpot at the moment. I know of a handful of them personally who, there's a group of people called biohackers, right, that do this to themselves. So the proof of concepts are out there. Is there anyone really looking to scale and commercialize that technology? I'm sure there are somewhere in a investor's office. But again, it goes back to how do you really deliver the value to the person that has to consume that technology? And it's the same problem I think we have in the wearable space. It's easy enough to convince an elite athlete to take a health monitor to improve their performance, and they will see returns on what they're doing over the course of several weeks, right? And what we're really talking about is asking people to engage in monitoring their health over periods where the transition to mental health issues is going to take many years, and we don't have that kind of buy-in from consumers at this point. I don't think they're convinced that if they wear a device for 7 days a week, 365 days a year for 10 years, that it's going to deliver enough value for the inconvenience. I struggle with the idea that we're going to say to those same people, okay, forget the wearable, we're just going to implant this, I don't know where actually. It's a big, big leap that, and I think we need to progress into it very carefully. Since just implanted devices are very sort of sci-fi, and I don't think your average person on the street is ready to be chipped. And again, I completely empathize with them, right? It's one thing to have the data on your smartphone hacked and the data from your wearables leaked, which is happening all the time, right? We have a massive trust issue in the digital health community, largely because a lot of the bigger players keep getting things wrong. To shift those same trust issues into implanted devices is frankly unethical, I would say. until we get the trust built into our digital health ecosystems and we have the trust from the people who are engaged with them, I would steer as far from implantables as humanly possible.
Perfect. Then we have a few more questions. Who should inform the patient to undergo further diagnostic testing? Portable devices delivering bad news are no sell, besides the ethical issues.
Yeah, I don't think anyone is ready to do that yet. That's not to say I don't think it'll come. I think we will see a broader acceptance of effectively AI-mediated communication with patients, but it's not happening next year or the year after, right? The position we're in is that we have wearables that can collect data, and all of it goes to a professional right now for review, and any action taken from that data is taken by that professional. I think actions taken by machines will be at least another half decade away.
Perfect. Then we have another one. I wonder whether your platform takes information or data from doctors back to your AI data. It is not clear whether you're only tracking vitals info in one way.
Oh no, so it's that's the stage that everyone's at, right? Like I said, it's super easy to collect data these days. The difficult thing is linking it all to the disparate health records so that you have like the verifiable gold standard medical data, right? I'm not pretending that gold standard medical data is not still the gold standard. I see a future where it no longer is, where wearables have superseded professionals, but at the moment, all of the work in identifying appropriate digital endpoints is about collecting the data that has been enabled through the devices that have been developed, referencing it to the current gold standards, and deriving new digital endpoints from that. So yeah, our platform does integrate with the electronic health records so that we can always cross-correlate what we're working with. We're still in the Biofourmis are still in the process of digital endpoint development, as are everybody else. There is no one who is in a position to say, we have measured X, which means Y, so do Z. That's still somewhere down the road.
Perfect. And then we have another one. Does internet surveillance seem like the most accessible and probably useful way for health preventive monitoring?
I'm not sure what you mean by internet surveillance, but I suspect it pertains to the keyboard reference. It's part of an ecosystem, right? I don't think that we're going to get all the answers out of any single device. As I indicated at the start, right? There's no one wearable to rule them all. We need to move into a future where we have ecosystems. So we're linking wearable data with smartphone data, with keyboard data. Like they're all little bits of a big picture. There's no one feature that is going to give you the answer to that person's health status. So we need to get at everything. Internet monitoring could mean many things, and my reference was to keyboards because they are, you have to interact with them. There's lots of things you can measure from a keyboard. If the question pertains to monitoring what someone is viewing on the internet, then that's an absolute no-go. We can't go anywhere near that, and it's not clear to me what it would provide to us, even if we were allowed to. And I'm not saying we should be allowed to. Regardless of what you could get from that data, it's not the sort of thing that we could ever countenance as a society.
Perfect. Thank you so much. We have a few more questions that we can take over into our panel session at the end of this group. I would stop the broadcast here and then move on to our next speaker. But thank you very much, Sam, for your time.
Thank you.